Because you should have come because you represent the civil engagement.
That's fine. It's always good to interest.
And I apologise.
We do. Minister, welcome to the House. When we were reviewing this legislation initially back in March, we were in a different situation, and in some ways, sadly, I have to say, a better situation. While we knew that there was a crisis, and actually many of us did know that this would be a long-term crisis, we did have a clarity of message and a clarity of purpose to some degree. The message was that we would flatten the curve, and during that period of time, we would see a huge investment in ICU capacity. I was pushing at the time, working around ventilators. How can we get enough ventilators bought and purchased? That we would have ICU capacity, we would have a huge recruitment drive. We were praising the fact that thousands came forward to say they'd like to work for the HSE and offer those. It's extraordinary that so many of those who came forward, both in areas like contact tracing and indeed in direct frontline healthcare, are still not in our system. These were the measures that we were promised at the time. There would be huge measures to scale up our response and our capacity, and they did not adequately happen, Minister. And there is a problem. There was a damaging of trust through that. Moreover, not only did we not use the time as fully as we should, but we didn't even follow through on that mission of fully flattening the curve. Because when we were at a point where cases were very low, and zero COVID was a very real and practical possibility with many experts advising it, we decided to jump a step, short circuit, and again the lobbying from various industries meant that we jumped ahead and we were premature. And again, I was against the loosening of restrictions at that exact moment because zero COVID was in sight at that time, Minister. There has been a damaging of trust in that context. All of us understand, I understand, and my whole group understand the severity of this health emergency. We absolutely send our wishes to all of those who have suffered, the 500 people who have gone through ICU, the 1,583 have lost their lives, and those who live with the long-term effects. And we sympathise with those frontline workers. But it is because of that we, Minister, need to be able to hold the government to account. We know that during the debate back in March, I had raised a number of concerns. Like many others, we were calling for the sunset clause, but also I raised concerns specifically in relation to the mental health provisions, in relation to what supports or advocacy might be involved. We were given lots of assurance of engagement and on forth. And here's the problem. Since then, I counted 7 queries that I sent in follow-up to that debate to the Department of Health, none of which were answered. I had to get TDs in the Dáil to put in PQ saying, what's your answer to Senator Higgins' question that you said you'd answer in the Dáil? Around, for example, and got a very weak answer saying that the HSE was finalising protocols and procedures around the support arrangements, around detention, and that was from May. Minister, when there isn't communication, when there is no channel, and I'd like you to commit here, what will the channel of communication be between the Department of Health and senators? How can you ask us to abdicate our scrutiny? And Minister, I will have chances elsewhere, but the priorities seem to be somewhat skewed. I'm shocked, frankly, for example, that horse racing and greyhound racing, whose only purpose seems to be to serve the gambling industry, are moving ahead, and we still have the issue of women not able to have their partner with them during very difficult maternity situations, including miscarriage. Minister, there was a problem in terms of information in the interim. There's a problem that we haven't been given the information we need. There also seems to be a real concern that the government at times seems to lack the information it needs. Can we be assured there will be proper contact tracing, not just to the future contacts, but to the sources? Because otherwise, we're in a cycle forever. And again, Minister, it's inappropriate that we would renew these measures without having a review of how the previous powers were reviewed. In that context, recognising the emergency that we are in, and the severe health circumstances and cases at the moment, I'm supporting the Sinn Féin amendment. I think that, Minister, but before that, I would add, before February, in the 9th of February, that extension that is looked, I would say we need to see a review of how the powers given were implemented.